Okay, well, good afternoon or good morning, depending where you are, to all the participants joining us. My name is Lizeth Hester, and I'm a program specialist with the Office of Family Assistance. We would like to welcome everyone to today's webinar on building resiliency and reducing trauma in Tanf and workforce program leaders and staff. As you know, state, local, and tribal TANF programs across the nation have struggled in supporting and retaining their talent pool. This webinar includes a panel of 3 innovative individuals who are working on improving the well-being of TANF and workforce leaders and staff. This webinar is being supported by Project Improve. We wanted to give a quick shout out to the Project Improve project officer, my colleague, Damon Waters. I'll now turn it over to Dr. Michelle Dare, one of the thought leaders on Project Improve, to introduce this session and the panelists. Thank you.
Thanks, Lizeth. We're super excited for this panel, but before we jump into the panel and the session itself and talk about the objectives, I just want to announce that Project Improve is supporting under the leadership of OFA a series on a leadership initiative. And it's called Improve. It's basically the Improve Leadership Initiative that will be launched this fall. So you may have seen it in the Peer TA Network email. If not, go back to your email. There's more information about it. We're holding information sessions about the Improve Leadership Initiative on September 20th and 21st. So more to come on that. So with that, I'm going to launch and jump into the webinar for today and just talk a little bit about what you can expect to experience today. As many of you know and have experienced that the country the country's struggling with some of the effects, residual effects of the pandemic and some of the shifts that are occurring within organizations, as well as in just addressing some of the needs of the complex needs of families today. And today, what I think we're going to talk about is really connecting programs across the country that are grappling with this common challenge. And then also to learn from some really experienced program leaders about how to support staff and create an organizational culture that's trauma informed. Now, I think what's really significant about this webinar and some of the activities that OFA is supporting more recently is, for years, I've studied TANF programs for decades, and we've talked a lot about the needs of families. Well, I think the pandemic has really shifted this focus onto the needs of staff and leaders as well. And it's one of those old adages where, it's kind of like you've got to put, whenever you're traveling, you hear those instructions, put your mask on first before assisting others. I think that same kind of concept applies in state and local and tribal TANF programs. And so this session really is focused about you as leaders, as staff, in really helping to provide you with more support and ideas so that you can support yourselves in better supporting families. So with that, we want to launch this session with a couple polling questions to get a pulse check on it. But before you even do that, we would also love to, while you're doing that, those polling questions, even put your name and organization, where you're from, in the chat, just so that we have a flavor for where you're from. And then we've got several polling questions right after that. So first, put your name and your organization and where you're from in the country in the chat, so that we know a little bit more about you and the panelists do. And then we have several polling questions as well. Goodwill Easter Seals in Michigan, in Minnesota. I know some of those folks. Cool. Pennsylvania, I've done some work in Philadelphia as well. TANF Program Administrator, Goodwill Easter Seals again. It's great to see the names of people coming in. Cherokee Nation, welcome. Virginia DSS, right in my backyard. I'm up in Northern Virginia. Pennsylvania, more Philadelphia folks. It's great. All right, keep those coming in and go ahead and answer the polling questions. Our friends and colleagues from BLH are supporting this. And the polling questions are right on your screen. how would you describe your level of stress in the past month? Would you say high, moderate, low, or you can choose not to answer? And then the second question is, to what extent has your organization experienced turnover as well? And go ahead and respond to those questions. And then click submit. And the third question, I just needed to scroll down. What's been the level of stress within your organization over the past year? And just go ahead and choose that. And then for the fourth question, this is open-ended. We'd love you to use the chat again. What efforts has your organization made to support you and your colleagues? If you could share that. And this is a way, an opportunity for us to collect ideas across countries for you to see what other programs might be doing. So what efforts has your organization made to support you and your colleagues over the past, or have you made to support your colleagues? And go ahead and use the chat for the fourth question. The others are survey polling questions. All right, how are we doing, Sujina? Do we have some polling responses? So high to moderate levels of stress. And turnover, super interesting. Almost 2/3 has been, there's been high turnover. And then the level of stress within your organization, again, high to moderate. And, again, I want to note that this is, we work in, many of you are emotional first responders, hearing the trauma and the experiences of families every single day, and leaders who support those staff who are hearing those stories. So under even the best of circumstances, you're going to have a lot of stress within your organizations, as some of our panelists will share. But I think the pandemic and some of the challenges that we're facing in this country today, it's really exacerbated those things. So we see some ideas coming in through the chat. All right, as those are coming in, you can scroll down those. I want to pivot now and shift to, if we could go to the next slide, introduce our panelists. This is really set up to be more of an informal conversation. We have three fantastic panel members who are very bright, very engaging, and I just want to very briefly introduce them and then allow them to introduce themselves in greater detail. Erin Quinn, who is the Associate Commissioner of Employment and Training Programs for the Massachusetts Department of Transitional Assistance, is one of our panelists. Vicky Coyte, who's the Director of Trauma and Resilience at Work in the Corporation for Skilled Workforce. Audrey Smulkin, the Executive Director on the Center on Child Wellbeing and Trauma. I have to say, once you get to know by the end of this session, you'll know these people not by their titles, but by the feel, the passion, the vision, and just their immersion in this issue and their absolute commitment and dedication to improving and supporting you all in better serving families. So without further ado, let's get rid of the slide deck and have Erin kick it off and give a little bit more detail about who she is and what she's been doing in Massachusetts to support her staff.
Hi, thank you, Michelle, and thank you for having me today. It's great to be here. Happy to see all you lovely people this afternoon. As Michelle mentioned, I'm the Associate Commissioner of the Employment and Training Programs at the Department of Transitional Assistance in Massachusetts. So that includes oversight of our Tanf work program, the administration of our Tanf program in collaboration with my colleague, Megan Nichols, as well as our SNAP Path to Work program, and also our internal training and development team. So that being said, I'm really passionate about this work, both in terms of all of the work we've done and continue to do to redesign our Tanf program in Massachusetts to be trauma-informed and responsive, and to move away from that very rigid, compliance-driven focus that we have had for years and years in the state, but also from a training and development lens and a staff lens, recognizing that the way we treat our staff is the way that they're going to treat the families that we work with. So this in particular is an area that is a passion of mine. I'm really excited about the work that we're doing in the state and continue to do with my colleagues on this panel.
And I'd like to next go to Audrey. Audrey and Aaron are working lockstep in really supporting the staff within DTA. So I'd love for Audrey to introduce herself, and then we'll introduce Vicky.
Hello, everyone. My name is Audrey Smulkin. I am the Executive Director of the Center on Child Wellbeing and Trauma. The work that I've been doing at the center is barely a year old. We just launched officially in Massachusetts as a center that really works with state organization and all providers that are child serving. But we had been doing that work for about 10 years informally before we were more formally set up by the Office of the Child Advocate and the state legislature. And I think the reason that's important is because it's a recognition of how much work needs to be done to support the people who support children and families in giving them lots of tools, strategies, and information on resilience. I'm seeing some fabulous ideas of support that are in your organizations popping up, from work from home, working on diversity, equity, and inclusion, EAP, mental health days. It sounds like there's some great work going on across the country. So I'm really excited to hear from and learn from you all, and hope to offer some tips and support as well. So I'll turn it over. It sounds like Vicky, you're up next.
Awesome.
Last
Thanks,
but not least.
Thank you, Michelle, Audrey, Aaron, Vicky. I'm Vicky Coyte, the Director of the Trauma and Resilience at Work team at Corporation for a Skilled Workforce. CSW is a 31-year-old national organization that's based in Ann Arbor, Michigan, but we're a completely virtual organization, so I'm right outside of Boston. And we focus on advancing economic mobility and racial equity in communities across the country. Our Trauma and Resilience at Work team is also new, Audrey. We officially became a team in May of this year, again, like you say, because of the increased need for this type of work in workforce development and human service organizations. However, I've been working on researching and providing trainings and all those nice things for a couple of years. And just to let you know, at CSW, we provide strategic assistance with leaders around trauma and resilience strategies. We do provide training. We also provide organizational coaching, which you don't see in a lot of organizations, to help improve the organizational culture to be more trauma-informed and resilience building.
Love it. So each one of you saw in the chat, and you've experienced firsthand and recently gotten into this business in some ways, into this important work, because of a pressing need. And I'm wondering if each of you can just share what you're seeing in state, local, and tribal TANF programs, and also workforce programs. Vicky, I know you do a lot of work in workforce programs. What are you seeing in particular around stress and trauma, and what are some of the roots of that? Anybody can jump in.
So I can start off what we're seeing in terms of providers and state agency workers in general, and then I'm going to hand it over to either Vicky or Aaron to talk more specifically about TANF. We're seeing really high levels of acuity and stress. I was happy to see in the poll that the numbers are not 97% on the highest level, but they are still pretty high. And I would actually guess that some of what people are rating as moderate, we're down rating because we've gotten so used to it. So what I'm seeing a huge amount of is almost the organizational equivalent of the swan kind of gliding across. We're getting the work done. We're doing the best that we can, but underneath the water, people are paddling as fast as they can and really struggling with that. We're seeing levels of acuity both with the recipients of services and the providers that are much higher than I had seen in the past, because I think we know that human service workers bring their own trauma backgrounds. They have much higher trauma backgrounds when you look at ACEs, adverse childhood experiences, is either individually in the home or in the community. We then add on increased racial inequities that we have seen growing in many in many ways over the last few years, and then we add on COVID on top of that. So I'm seeing pretty high levels of stress. What I do like is that I am seeing organizations really respond and start doing some of the work. That makes me really happy. I did see someone just posted in the chat, we're still recovering. So everyone keeps saying we're out of COVID, and yet we're not really out of COVID, and we're starting monkeypox, and we still have the racial inequities, and we still have poverty, and we still have inflation. So I think there's been a big focus on let's build that resilience, because we know that a lot of things got really disrupted and broken, but I'm still seeing the stress. So with that, I'm gonna open it up to Vicky or Erin if you want to hop in.
Sure. And from a TANF perspective, I'd say that I second absolutely everything that Audrey said. And we're also still seeing that people are tired, right? Like they're tired, they're weary. It's been a very difficult several years. And when we started talking about a recovery from the pandemic or a recovering economy, I think we very quickly realized that these are stressors that are going to be with us for a very long time. And this is a brand new economy and a brand new kind of movement in terms of workforce development and the social and cultural aspects that we're seeing that are just new for people. And at the same time, we're seeing such a high level of turnover, right? And we're seeing staff that had a peer network before that they were used to have right now, because they don't have those same peers and that same peer support network that they had when they were going to work every day and working in kind of the traditional way that we were used to working, and not in this hybrid work environment that we're in now. And for our TANF families, they're still grappling with an exceptionally high level of stressors in their lives, everything that Audrey just mentioned. And we're looking towards, what does that mean for the future of workforce development strategies? And what does that mean for how we approach our TANF policies? And I think change in this area really has to come from leadership, right? It has to come down from the top in terms of being really fully committed to being trauma informed and responsive, and making sure that our staff and the families that we're servicing can really see what we mean when we say we want to implement these strategies, right? It's action based. It's not just the way that we talk about our staff and our families.
Those were great answers. I can only add two things. Echoing Audrey's swan analogy, what I've been seeing is that, we had all of those challenges: racial inequity, racial injustice, historic racism, poverty, inequality, prior to the pandemic. And we were operating at a chronic level of toxic stress and trauma, which we could manage. It was kind of like having a chronic health condition. COVID-19 and the resurgence of serious racial injustices and being right in our face and on our TVs sent us to the emergency room. And so that's what we're trying to recover from now is, as Audrey said, an acute situation. So I think that, in addition to all those stressors, we have that stressor of having been in the emergency room. So, we try to keep that in mind as we're working with staff. The other thing that I'm seeing is that I agree that I think that organizations are starting to do things to help staff. And I was so excited to see all the great ideas in the chat. I feel like some of you had a peek at my notes somehow in preparing for this webinar. But I want to make sure that those strategies go beyond just helping staff survive the current acute situation and move towards being organizational culture change to really help us thrive again in our work. And that's harder. That requires more intentionality. It requires more time. Sometimes it requires some outside coaching to keep you focused on it. So let's not let this opportunity go to waste, and make sure we get that cultural change that is much needed in our organizations and really in organizations across the country.
And Vicky,
I love what all of, go ahead, Vic. Go ahead. No, go ahead, Audrey.
So I just want to hop on something Vicky said, because it really echoed with me that I think a lot of the work that we're seeing going on right now, and I'm thrilled to see it, all of the resiliency work, doing anything in resiliency is great. But a lot of the work that I am seeing across the country is much more what I would call transactional support. So we will give you work from home, which is great if that's something that's helpful for the workforce, versus what I think Vicky was just referring to, which is really transformational resiliency, and culture shift. So it is wonderful to have those key components in place, whether that's, work from home or meetups or EAP or many of the other techniques. I think those are fabulous, and I want to keep them surfacing in the chat. But what I think we're really after is, how do you transform a system and the way that people are treated? So we talk a lot in my world about self-care, and I recently really switched that language from self-care to system-supported care, to try to get at the fact we're really transforming systems so that the way they interact with their workforce, and therefore, as Erin really brilliantly put it, the way they are treated is generally the way they will treat and interact with their clients. So that we have really system support by having a system that is resilient, a system that is respectful, and a system that is promoting that kind of equity, so that it's not just the incredibly important transactional supports that we're seeing in resiliency.
I love what you just said, and I want to pick it up, Audrey, because it's so powerful. One quick question I want to slide in there before we go to this, and I think I want to expand on that, and I know Vicky and Erin are going to pick that up and run with it too, and that is, given the stressors in the environment, what's the cost for that? We're noticing that there's this trauma, we're noticing that there's this racial inequities. What's the cost? Why should people on this call care, and others across the country, care about this topic right here, right now?
So I'll take a crack at that, and then I bet Vicky and Erin both have some really good answers there. It's much like when you look at some of the economic modeling around racism, you can say it's very similar in the cost to the system. So of course, I think we should all care, because we're all human beings and we want to treat each other in a way that is promoting resilience and well-being and guiding us all to be the best that we can, and give our staff the best that they can, and they give our clients the best that we can, because that's human. And I think that makes us better all as human beings. However, I was raised by an economist, so I also have that lens in my mind. Not being resilient, not promoting resiliency is extremely expensive. So I recently was lucky enough to be part of a panel discussion related to the work called The Sum of Us, which was really focusing on the high cost of racism. It's a fabulous book if folks have not already read it. What came up during that conversation, and the reason I keep paralleling it with racial equity, is because I do think racial trauma and racial equity are a huge part of getting to resilience. It's very expensive to not deal with this. You will constantly see the turnover in your system. You will constantly see families really struggling, so they're staying in the system longer, which is expensive and costly, which promotes turnover. What I really want to see is a cycle of support. So if you think of the DTA workforce, or really any provider system workforce, treated and supported with true transformational resilience, that is going to transfer over to the families and the clients that they're working with. That is going to transfer over to healthier families and kids, which ultimately leads to more resilient communities and feeds back into a healthier workforce. I think it's very expensive. It's expensive on the moral and ethical level not to focus here, but it's also really expensive in dollars and cents, and billions of dollars we're spending burning through people, churning through people, retraining people, and then repeating the cycle. So I think a lot of people on the call probably are on it potentially for both reasons. We all want to raise ourselves up to not be that swan that's swimming like that, but truly being able to glide a little bit, and also because it's really ineffective and inexpensive to not address the stress and the trauma that people are under.
It's so funny. I feel like sometimes Audrey is like right in my head, because I was going to say something very similar around the fact that it's just the cost to us all, right? It is very expensive, and it is a cost across all of those facets that Audrey just mentioned. And it reminds me very much of like the groundwater approach, right, around racial equity work, right? It's just, if it's not a systemic fix, if it's not something that we're looking at, if everything is interconnected, and we can't kind of isolate a solution that just targets one specific priority population, we have to look at it something that injures us all as a society, and really has a much more adverse impact for those people that are low income, for those people that have a higher set of risk factors, that have a higher set of barriers. And we can pour as much money as we want to into workforce development and training. And if we don't take a holistic approach so that people can be successful in those positions and in those programs where we're investing all of those dollars, you're just going to see that recidivism in that cycle, that toxic cycle of people that are just not able to move ahead in the way that we would like to see in their lives holistically, not just in their workforce or their employment goals, but holistically, because we're not addressing the groundwater problem of not being trauma informed.
Ditto to everything Audrey and Aaron said, and if the business case is what turns you on, I just put a resource in the chat that has tons of data on the business case for what happens when employers ignore mental health in the workplace. Two additional things I would note is one, again on the cold-hearted side of things, Tanf performance measures. You're not going to meet your Tanf performance measures if we don't get better customer service, healthier behaviors that staff can adopt and with each other and with customers. And two, trauma crosses generations. We know this from research, epigenetics. And so the more we continue to allow current clients to be traumatized, it will just keep getting passed down to further and further generations. And we're locking those generations out of economic opportunity, out of equity, out of being able to have healthier, more economic, secure lives for themselves. And I would love to get into the brain science, but just trust me, trauma stays in the genes and it will continue to affect generations down the road.
Thanks, Vicki. Thanks, all of you. So I failed to mention, put your questions now in the chat. I'm going to come back to them in about 10 minutes, but start to put your questions in the chat. I'm going to keep us moving with that kind of bra burning. Audrey got us kicking off on that, not to be transactional, but like systems change. And I also want to invite, what are some of the adjacencies to get to that systems change as well? What are some of those small steps that can put you on a course that's going to affect that systems change that you're talking about? All right, take it away, you guys.
Well, some of the systems change pieces that we've tried to encourage and we've started to see around the country is looking at the workload, how many cases individual case managers get, and how those are structured. Are they structured as they land on an individual's desk, or is the group structured as a team in which they're able to support each other when cases are high or a case needs a more intensive effort? Looking at job descriptions and ensuring that your staff are more trauma informed and resilience building, and they come with those skills. Looking at your professional development and making sure that staff get the training that they need, get the support that they need in order to be able to adopt this mindset. Making sure that staff are taking their vacation days, their lunch breaks, really enforcing that. Those are small things, but nobody in this country, it appears, every statistic I look at, ever takes all their vacation days. Those are resilience building days. And if you want your staff to be resilience focused, they need to take those days, and we need to figure out how to make sure that when folks take vacation days, other folks just aren't completely overloaded, which means we also need to figure out how to build what's called slack in the system. And that actually comes from the private sector, from MIT actually, where slack in the system is when you have a little bit more staff than you actually need in order to be able to handle when a staff person calls out sick or when they're on vacation. And I know it sounds like I'm, a Martian or an alien coming and saying all these things that are like completely impossible in Tanf. But those are the things that we're going to have to do in order to be able to get that systems change, that cultural change shift. And we're just going to have to figure out how to do it.
Yeah, and I think I would add that, when we're aligning our policy, our programs, our practices with these kind of really guiding principles, right, that they all have to happen in tandem.
Your audio's a little wonky, Aaron. Just a little wonky.
Approach of examining it. Like, is it cutting in and out?
Yeah, a little bit.
Okay, I'm going to try to disconnect and reconnect.
All right, so while Erin is getting to a more resilient and strong space, I'm going to hop in just to chime in on what Vicky was saying with a couple of other pieces that I would suggest folks think about. Because it, Erin, are you guys hearing Erin and I at the same time or no?
Yeah,
I think it was a
Audrey.
delayed.
Oh, okay.
Yeah,
so I'll keep going.
ahead.
Just one other piece for folks to think about is it's not enough. It's a great start to work within your own system, but also be aware of your contracted providers that are supporting your workers. So a lot of states really work with the contracted providers to do a significant portion of the work. Making sure that they have language training and support around trauma and resiliency is super important. Contracts that go out that say you must have some training related to adverse childhood experiences, positive childhood experiences, secondary traumatic stress, racial equity, a whole series around being trauma informed and responsive for your providers will give them the space, the permission, and the ability to provide those kind of trainings for their staff. So I would just encourage you to also think of the role of the providers, because even if you make that transformational change at the level of your state system, if your providers are not acting in concert with that change, and they won't unless it is part of your expectations of them, which often does come down to contracting. So I just wanted to toss that in there. And then the other thing from what Vicky said is we found in our state, when I called it building in slack, everyone was horrified. You know, I'm from New England. We are Puritans. We work hard. There is no slack. So we started calling it bench support. We also love our Patriots. So the sports metaphor worked, really meeting organizations where they are to be able to say, you would never have a sports team out on the field working as hard as they need to work without the bench being there. You need that bench support because you have to assume that people will be out for those resiliency days. So how are we going to make sure, A, they're not slammed the minute they come back, that, you know, nothing was covered for them, and that they have the chance to really recharge. It looks like Erin's back. Erin, I was stealing your thunder while you were gone. So back to you.
I'm sure you were not, but thank you. Can you guys hear me a little bit better now?
Yes, thank you, Erin. Thank you, Erin.
So I missed a little bit of Audrey's response, but a few of the things that I just caught, I think are really important to continue the conversation on. One of them is the contracting and setting the expectation with your providers. It is, and we're very much in this work. We're not at a finished product yet when we're looking at our contracting and procurement practices. It's not just establishing what the expectations are in terms of the scope of services and the alignment between state agencies and organizations and the providers around the expectations around being trauma informed or in alignment with our values around racial equity work, but also how you build in the accountability for that in a way that's meaningful. And I think that that is one of the more challenging aspects of it. We can get together and all have a very strong vision of what we want to achieve, but how we measure it, right? You get what you measure, and what are the quality kind of data analysis and strategies that we need to be able to meaningfully measure it, to then be able to perform or inform future program and policy improvements, I think is a huge piece of that. Like, I'm not a data wonk, right? Like, that's not my area, but I love the effective use of data. And I think that that's just a very important piece of the conversation, especially around contracting and procurement.
Thanks, Erin. Vicky, you can just chime in.
Okay. Racial diversity, equity, and inclusion has been mentioned a couple of times, both in the conversation and in the chat. I just wanted to point out to people something that seems obvious, but it actually helps to relieve what feels like an overwhelming burden to do all of this work when we're already all slammed. There's huge overlap between racial equity frameworks and trauma and resilience frameworks, as well as human-centered design and job quality, if any of you are familiar with the whole job quality movement in workforce development. So as we're making progress on one of those, we're actually making progress on the journey in the other one as well. So we can think about it, you know, working on this and adopting these system changes. We're getting a twofer or a threefer or a fourfer, depending on, you know, how you look at it, because we're really making progress on a lot of these important efforts that we need to make progress on.
Vicky,
Thanks,
I
Vicky.
didn't understand what you said about that last piece about, it sounded to me like Jack, so I'm clearly still thinking of my sports metaphor, but can you expand on that a little bit, your last piece?
Well, just around, when you look at the principles of being a racially inclusive and equitable organization, people having a voice, people being respected, having empathy, understanding where folks are coming from. Those principles in racial equity and inclusion are also in trauma and resilience principles. And so as we're working to be more racially equitable and inclusive, we are also actually being more trauma informed and resilient in our organization. So I just want to point that out in case people
That's
are feeling like,
perfect.
oh
I
my
love
God,
it.
I've got to do
There
a
was another
TNR.
circle, but you said there was
Oh,
another circle.
another
That's
circle,
what
human-centered design.
Human-centered.
human-centered
Have
design.
folks-
Thank you.
Yeah,
I missed
sorry.
one there. No, that's great. I did want to flag, because I want the answer to this too. Somebody named Jose asked a great question about identified TANF performance measures related to trauma generational challenges. And I am hoping folks who know more about TANF can answer that, but I will just share, we do try to measure when we do trainings related to trauma, race, and resilience, and Vicky's 100% right. We only call them trauma, race, and resilience. They are not delinkable in our work or our mind, but we do kind of measure not only what we consider to be outcomes, i.e. have all of your staff been able to go to a training? Have you made them available and attend? But even outcomes related to, is this reducing your turnover? Are you getting higher satisfaction surveys from your clients? So there are really ways to measure whether you're moving the needle in terms of trauma and resilience. However, I don't know myself how those relate to TANF performance measures. So I'll turn that over to the geniuses who focus in that world.
So I can't, and Michelle, feel free to jump in here in terms of the, the TANF question. I can't see the question in the chat anymore because I rejoined. Can someone read it?
It says, are there some
Yep.
identified TANF performance measures that address working on trauma generational challenges? And he just reposted, or somebody just reposted for you. Or maybe ways to measure progress in these areas. What is incremental success?
Yeah, so this is a very interesting question and something that we work on a lot outside from just like standard demographic reporting measures that we collect, to be in alignment, right, with federal reporting requirements. That doesn't really get to the heart of that question, right, which is what are any disparate impacts, or what are the disparate impacts across performance outcomes for our TANF work programs that we really want to examine, and what can we do about that? So one of the things that we've been looking at in Massachusetts around our racial equity work is doing a different type of kind of data analysis around racial equity indicators and the way that we collect data to measure and examine things like the rate of enrollments, right, across different demographic groups for specific work programs, TANF work programs, and do we see any overrepresentation or underrepresentation in who is referred to specific programs, and what kind of assumptions or bias does that mean exists in the system that we know is kind of baked in, right, both with human behavior and just the systemic structure of the TANF work program, which we all know has, very racist roots. What can we address through performance, and what can we address through systems changes, and what are kind of larger, larger biases, larger systemic biases that'll take a much broader approach for us to be able to achieve in terms of really restructuring TANF, right, and re-envisioning what TANF should look like. But we can do a lot with the data that we have. It just depends on how we want to examine it and how creative we want to be. So that's kind of the first phase of the work for us at BTA in looking at our work program performance data, is to see if we can start to identify any of those disparate impacts, over underrepresentation, those types of things for priority populations, including people with disabilities, right? Including, it's not just a conversation around racial equity, including young people, right, and young parents, and what does it mean for them to navigate the TANF system, and to use the data that we do have while we're also working on improving the data collection and analysis opportunities that we have, to start asking the right questions so we can start focusing on some solutions to those problems, or at least some more creative ways that we can identify ways to improve the performance of our work programs.
So just one more quick resource while I invite you guys to put questions in the chat or unmute your line while you're thinking about that. But another element, I love what Vicky said on this kind of crosswalk, is the federal government supported years ago, and including OFA, and continues to support a model called Learn, Innovate, Improve. And some of you have heard about that, LI squared. And that in and of itself embeds in human-centered design, listens to diverse perspectives. It really includes co-creation in organizational change. By following those kinds of practices, you're inherently being more inclusive in making those shifts. So thinking about these small steps you can use and routines to create muscle memory is really the point that we want to make. And I know Erin's used LA Squared a lot, but again, that's another resource that's available, supported by the federal government, and some of you on the call have used that model as well. But that's the kind of thing. Adopt strategies that are easy to use, that are pretty simple, straightforward, but that are more inclusive, that are more get at participant voice, get at staff voice, get at not just leaders making decisions alone. All right, so let's see. You're welcome to unmute your line and share any reflections, share any questions, or use the chat. I'm just going to pause for a second to see if we can get anything through, see if there's any questions that come up. So while that's coming in, and go ahead and unmute your line and just interrupt me. What advice do you have for leaders, in particular for leaders? I mean, I always say that leadership matters, and creating and setting the tone for organizations, organizational culture, structure, all of those things. What specifically would you say to leaders if you had them in a room right now and could teach them, share with them what to do? I mean, great suggestions, but specific to leaders.
So I'll jump in. I'll also let you know, if you didn't see it, Michelle, that they were asking for you to repeat the name of the model you referenced, which I believe was Learn, Innovate, Improve, LI squared.
Yep,
but just
we can put a chat in the chat. Go ahead.
A link to that might be great. I would just say for leaders, to me, the most important thing leaders can do right now is really work on transformational change related to racial equity. I have not seen that change at the leadership level. What I have seen is a fair number of transactional changes, looking at how many of the workforce do we have that meets different categories. I have not seen the real work go into what does it truly mean to promote racial equity. I think if you don't have that, getting to any kind of resilience is really, really hard. The second piece I would really say is having leadership on board with the knowledge and skills to be trauma informed, so that they can understand when their staff are exhibiting secondary traumatic stress, understand what their staff are coming in with, which may be higher rates of trauma, and understanding some buffers around positive, healthy experiences that can buffer some of that trauma. So really giving them the knowledge. I get asked to train all the time for the staff, and it's very clear, come on in, train our staff. It is the really rare and amazing, like Erin, folks who say, train us. Let's talk at the leadership level, because as much as you want to make the training available to every single level, until there's that transformational change on the leadership level, you're really not changing the culture to be trauma responsive, to be resilient. So what can happen is the staff say, I've learned all this and now I really want to see it in the workforce. And the leaders say, well, wait a minute, what's going on? That wasn't what I promised you. So really getting the leadership to understand how to make that transformation.
That's huge. I was actually going to out myself with Audrey in the conversations that we have, because certainly I'm guilty of this. I'm a very action oriented person. I'm like, let's move, let's move, let's move. What's the next thing that we can do, right? And having the ability to be self-aware enough to say well, what do you need for support? Who is available to support you? And what is missing in terms of what you need to actually exact some transformational change is a really important question to have with your peers and fellow leaders, and to be honest about, right? So I would be the first person that would have come in and been like, Audrey, come train all of my full engagement workers, and I just love this work and I just want to move, right? But the real question was to back up and be like, well, what is it that you're actually trying to solve, and think bigger than that? And what are you missing? What are you missing at the leadership level that you need to make this stick, to make this meaningful cultural change and not just kind of something that you provided as a benefit and somebody was like, great, those were 4 great sessions, and then I'll never hear from it again from this leadership team, because it's just, that seems disingenuous, I think, when you're trying to set the tone for the top for your staff to say like, this is truly meaningful, and it's meaningful enough that we are going to commit to it always being woven through our training, our development, right? Universal design approaches to our training and development, human-centered design, and that complement between service delivery and training and development. These are things that all have to be committed to. And that means that you constantly have to go back and say, what is it you're trying to solve? And what are you missing at the leadership level to make this continue to be successful?
Yeah, I would, this is a different way of using Audrey's transactional to transformational, but I would move beyond just checking the box. We provided that training to planning for sustainability. How is being trauma-informed and resilience building going to be sustained in your system, your organization, your staff, your leadership? So that requires training, ongoing training, because you have new staff all the time, so they constantly have to be trained. It requires organizational cultural change, and so we always encourage organizations to go through a self-assessment, leadership at the leadership level, and then also the organizations delivering the service. And there's, several assessments that you can use out there, and we can, point you to those, but do that regularly. Every year, assess how much progress the organization has made on being trauma-informed and resilience building. And a very practical idea that we've implemented in Detroit, which has been pretty cool. I didn't know how well it would work, but we created a trauma and resilience ambassador program across the career centers in Detroit. And the career centers in Detroit work with both workforce development, WIOA, and TANF programs. And the ambassadors, it started out as like a train the trainer, but it's really more champions for keeping that conversation going around trauma and resilience in the organization. And it includes both frontline staff and managers and supervisors, because the frontline staff know what's going on at the front line, and the managers and supervisors are the ones who can have, make decisions and make changes in policy and practices. And we have one at each career center. This group has done so much to change the culture at the organizations. It's incredible. And so I would highly encourage trauma and resilience ambassadors in your organizations, in your teams, to keep this conversation going, keep it on the radar, and really help with that sustainability. Because, our organizations will be gone at some point, and we want this to continue.
Any reactions to what Vicky shared from Audrey or Aaron or the rest of the group?
Vicky in general is brilliant, but I was busy scribbling everything she said down because I was like, oh, ambassadors, that's a great idea. We have just are in the process of launching in Massachusetts a community-based coaching academy on resilience and trauma that will be for community providers, not necessarily in a state agency or a TANF system, but it's a really similar theme around making sure that just like somebody's responsibility is to, in child welfare, enter the data for AFGARs, there's somebody's responsibility to make sure that trauma and resiliency work continues, whether that's continuously offering the trainings, looking at the systems and policies, really making it somebody's job. Because as Aaron said, what gets measured is what we're going to focus on. And I see a comment from Damon about, if the things that we are measured on are more check the box administrative tasks, then how do we get to this really outcome-based program? And I think that's something that all state systems struggle with in terms of saying, I'm more familiar with the child welfare world, but how many kids did we place? Not did we place them so that they're permanent and they're healthy and they're growing and there's resiliency and their trajectory has changed, but just how many did we place? And I think that's going to be a constant struggle. So it's it's up to the state system to really say what is within our locus of control that we can really manage in the most resilient outcome-based way we can. We on this call probably are not going to necessarily change what the federal system is going to always look at in terms of what's reported. Some people on the call maybe could, but in general, that's not our journey. Our journey is to say within what we can control, are we doing it in a way that is the most strength-based, resiliency-focused, outcome-focused? And I'll let Erin and Vicky chime in next.
Yeah, and I think there's two additional points I would want to make on that. In terms of somebody that's in an advocate or a liaison role or a coaching role, I think it's always really critical that these positions, when we're thinking about them, are positions that can be supported cross-secretariat, right? Cross-agency, that are positions that you truly have buy-in, especially at the leadership level, at the state level, for people to come together and collaborate cross systems. Because sometimes I think we have a tendency to create these specialty liaison roles within our own system, within our own agency, and we're like, they'll just go out and collaborate with everybody, right? And that's a very tall order to ask somebody at the local and the regional level, although 100% the local community-based level of collaboration is so critical, but it needs to happen at the same time at the state level, because if you don't have that buy-in, cross-secretariat, cross-agency, whatever the case may be, you're actually going to prevent that individual, that position, that liaison role from being as effective as it could be if they could move more fluidly with support cross systems. And to Damon's question around the bureaucratic administration and tasks that drive us all crazy, I think we need to really examine them and say, what do we really need, right? Where can we build some efficiencies in by eliminating some of these bureaucratic roles and bureaucratic administrative tasks that we have that we kind of created for ourselves because we created more complicated systems of tracking things, more complicated systems of reporting things that we really needed to. One thing that comes to mind, right, for all of us is the federal work participation rate. And where have states maybe created more complicated systems for that? That's an administrative burden that we could eliminate if we started re-examining the way that we do that, so that we can open up some more opportunity for folks to have more time and more capacity to focus on the things that we know are really meaningful.
I saw Damon's note, and I feel like I want to write a paper on the trauma of paperwork. Half joking, half serious. I mean, it really does take you away from the good work. I mean, it's got to be balanced with accountability. I just want to kind of shift and see if, again, keep your questions coming in the chat or unmute your line, but I want to kick it. Let me just pause for 2 seconds and see if anybody has a question or wants to unmute their line with to share something. Pause for. All right, then I want to kick it back to our panel and say, you've shared a lot of very concrete strategies, and I love this session. I think it's super helpful. I feel like we could write a brief just on this session. What's one or two pieces of advice that you would say to give to people on the phone, on this call, on this webinar? What advice would you give them?
So I want to go back to what we talked about at the start of the call, where I was really trying to distinguish between self-care to system-supported care. So for all of you all that put in that you were at a high level, certainly, and I'm a little suspicious of you moderate people trying to seek that golden mean, because I'm suspecting it's actually a little bit higher, just what I'm seeing. And I want to really encourage you to say, what are you asking of your system? Are they giving you what you need? What factors could you put in place to support your own resiliency journey? So are you treating yourself with the kind of resiliency supports that you need? And I think as leaders or as people who are reaching out and trying to get information and do the right thing for your staff and your teams, we sometimes forget to take that moment and look at what's going on for ourselves. Are we feeling that level of burnout? Are we feeling that level of unsupport? And what do you need to do so that you have some resiliency in your world? Because none of us can pour from that empty cup. And I want you all to be the swans that are just kind of gliding along and not going like that, because that is truly unsustainable. So if I can leave you with something, it would really be to check in with yourselves. It sounds like you're all very eager to do what is right for your staff, for your team, for your clients, but checking in with yourself to support your own resiliency journey. And there are lots of things that can be done to support you in that. I'll also pop in the chat my website. We are kid focused, so everything we do is kid related, but there are some tools on racial equity. There's trainings and toolkits and resources, and I hope you take advantage of all of them.
Yeah, Audrey's website is incredible. I cannot wait to dig in deeper. And Audrey, we've just got to have a phone call. There's so much synergy going on here. Brilliant, brilliant stuff. I would just say two things. One is a lot of people think that, being trauma informed and resilience building are all these like complicated practices, and you need to be a therapist or a counselor or a social worker in order to be able to do it. And they're like, oh, I'm not any of those. I'm going to stay away from this. But there are so many simple things that we can do to be more trauma informed and resilience building. In fact, you're probably doing a lot of them right now. You just don't recognize it because you don't have that lens yet, or maybe you do. I think several of you do because of what we saw in the chat earlier. So keep that in mind, that this isn't actually a lot of the day-to-day practices aren't huge lifts. The system practices and changes are, but the, what we can do day-to-day are not. The other thing is we have built such a hierarchical power-based structure in our workplaces that a lot of people are afraid to talk to their supervisors about these issues, about if they're overworked. And so then they try to hide when they're overworked, and then it just boils over into this mess. Remember that your supervisors are humans too, and they are experiencing toxic stress. They may have had trauma that they are trying to deal with. They may be re-triggered in their trauma. And I would say, treat your supervisors as humans first and supervisors second, and don't be afraid to talk with them about these issues that you may be having, that you're seeing your colleagues having, that your clients are having. And don't be afraid to be vulnerable and have honest conversations about these challenges, because we're not going to get past this unless we can have those conversations with each other.
I think I would definitely echo that. I think I would add two things. One is to, especially in leadership roles, to be patient with yourself in the same way that you're patient with your staff and with your peers. These are very difficult challenges, right? If they were easy, we would have solved these and we would have best practices and everybody would be moving on to the next challenge. And systems level change takes time, right? And for those of us that like to see things move quickly, I think it's easy to move towards a higher level of burnout because of that frustration. And the other thing I would add is that it's really important to take a look around and see whose voice isn't represented in the room when we're having these conversations, and to continually be committed to recognizing that, not being afraid to call it out, and not being afraid to say this is something we need to rectify if we're actually going to be able to move the needle in trauma-informed spaces and racial equity spaces. And sometimes that's a challenge, right? Especially at a state systems level, to have adequate representation, but that doesn't mean that we shouldn't be asking the question every time.
Fantastic panel. OMG. It's rare that I'm like, I'm facilitating. I've got to get back on track. I'm so enamored in what you're saying and love what you're saying. Thank you, new and old friends. We're so appreciative of your time and your expertise, and look forward to following up with you afterward. Lizette, you get the last word.
So on behalf of the Office of Family Assistance, thank you to the panelists, Erin, Vicky, and Audrey for their presentations and their insights, the Project Improve team, OFA contractors, Mathematica, and BLH, and to all the participants that joined us today. We hope the webinar provided a fruitful discussion and highlighted ways to embed trauma-informed approaches and resiliency strategies to support systems change for a better Tanf for both the recipients of services and the staff and leadership providing services to continue to build resiliency and reduce trauma. So thank you, everyone.